Black Americans are receiving the COVID-19 vaccine at a significantly lower rate than white people nationwide. A new report from the CDC shows that those who have received at least the first dose of the vaccine, 5.4%, have been Black, compared to 60% who are white. This comes as Black Americans are still hesitant to get the vaccine, with many citing fears about personal safety. So to help us break down what is happening, I want to bring in CBS News political contributor and Democratic strategist Antjuan Seawright. Antjuan, thank you so much for joining us. You recently wrote a piece about leveling the playing field for communities of color who need access to the vaccine. Oftentimes when people talk about this issue, they love to bring up the Tuskegee experiment. It is not just about Tuskegee. Many things have happened since Tuskegee when it comes to healthcare and African Americans and the failure of the healthcare system in this country. And also, it's not just about skepticism, it's about lack of access. So can you talk to us about how you see it, why the vaccination numbers are so low within the African American community?
Well, as I was taught growing up, those who participate the least are impacted the most. When this virus first started, I think we had a conversation. I said, Black and brown people are less likely to be tested, less likely to be treated, more likely to contract the virus, more likely to die, and more likely to be on the front line working during this pandemic. All those things have panned out to be true, not to mention the economic hardship that has been as a result of this virus. And now here we are when it comes to vaccine distribution. Black and brown people, those who are impacted the most, are being vaccinated the least. And accessibility is a huge issue, particularly when it comes to Black and brown people in this country. You take South Carolina for an example. If you travel to rural South Carolina and you're asking senior citizens to sign up on the internet in order to be vaccinated, you're going to have a real challenge because, one, around this country and in places like South Carolina and the rural South in particular, there is very little access to internet. Two, if you're asking a 65 or 70-year-old to fill out something online, they're going to look at you like you're crazy. And most of them do not have an Antjuan or a grandchild or a relative to help them do this stuff online. And so it's a real challenge for so many people in this country. And unfortunately, until we get our arms around this, it's going to continue to be a widespread problem. Not to mention, you have so many states not even tracking the data of who's being vaccinated, when, and how. And that's also a real challenge that we have to address in this country.
Yeah, I think, what you just brought up is spot on, and you kind of started to talk about, the rural Americans, and certainly access to the internet is one thing, but we just did a story on what's happening in Alabama, and, if you're not in a city center area, that means there's a good chance that you're going to have to travel a long way to get that vaccination, and some people don't have the ability to travel, and like you pointed out, they may have a grandchild or that could be available, but they're scheduling. Sometimes people are working in frontline positions, and so there's a risk of exposure when you go visit your grandparents, so you might not want to visit them. There are a lot of other factors. Skepticism, though, does play a role. I don't think it's as big as a role as access. One of the ways it seems as if skepticism is being tackled is by ensuring that prominent African Americans receive the vaccine and, talk about it. We've got Vice President Kamala Harris. We've seen sports figures. The very first person in this country to be vaccinated was an African American woman. I'm wondering, what your take is on this strategy to sort of diminish skepticism, because I'll kind of give you a little bit my take is that I think it's really good to show prominent African Americans being vaccinated, but I think we also have to discuss why the skepticism is there, and it's simply not enough to say, hey, this famous person believes in it, you should too.
Well, we cannot sanitize history, and Black people in particular have a long history of vaccines in this country and the impact and what it has meant for generations. If you look at the polio vaccine and how that went during that day, and so there's a lot of reluctancy, particularly among seasoned African Americans. However, when the vaccine is available, I'm going to take it. But here's what I said to so many people who are in this process of trying to figure out how we reach people where they are, because that's what it's all about. reaching people where they are. Yes, we need national validators, but also we need local validators. Most people in communities that look like ours, they play local and they stay local, and so we have to make it accessible and affordable. But we also have to remind people that it's safe, and reminding people that it's safe is having, whether it's the local pastor, whether it's a child or a grandchild, take the vaccine to demonstrate that it's safe to do and it's going to be okay in the short and long term. But the other piece of it is just making sure what you touched on earlier is that making sure people can get to places where the vaccine is being performed. And that has been a real challenge all across this country. You're not going to get a 65-year-old or even a 35-year-old who do not have access to transportation to drive 20 minutes on the other side of town in order to get the vaccine. It's not going to happen. It's the same thing when it comes to voting. You're not going to get someone to drive 30 minutes on the other side of town if transportation is an issue in order to cast their vote. And so I see these two things as two things that kind of run together: access to the ballot box, but also access to the vaccine.
And just really quickly, we are talking about black folks, but this is not just about black folks. This is about, this should be a concern for the entire nation. Why should it be?
Well, because when one hurt, we all hurt. And we're all in this thing together, taking the politics out of it, taking the social economic status, taking the geographics out of it, even taking the demographic part of it. We all need to be vaccinated. We all need to make sure healthcare in this country is accessible and affordable. And the truth of the matter is we cannot get there if groups continue to be behind when it comes to things like vaccinations and having access to care in this country. In particular, black and brown people who continue to be behind in several categories in this country.
Indeed. Antjuan Seawright, thank you so much.
Thank you.